Today I'll be demonstrating on how to wrap a wrist and hand using a figure 8 wrap technique, along with wrapping an arm using a spiral wrap technique. Bandages are used to apply pressure over an area, immobilize a body part, prevent or reduce edema, and to secure splints and dressings. It's important to make sure the bandage is not too tight as to cut off circulation in the limb, but tight enough to provide enough support. So now I'm going to demonstrate on how to do a figure 8 wrap on a wrist. So what you want to do is you want to start wrapping, and you want to make sure you wrap around twice to anchor down the bandage. And then what you want to do is you want to go around like this. And then go around again. And then once you're finished wrapping, you want to make sure you secure the bandage into place. And then that's how you do a figure 8. Okay, so for the spiral wrap, you want to wrap the bandage all the way up the limb, and spiral wraps are more for giving support and applying pressure to a larger area such as an arm or a leg. Spiral wraps can also be applied to a limb to compress the blood vessels and help control bleeding. Typically, you would want to use a wider bandage, but for the purpose of this demonstration, I am using the ACE wrap that I currently have on hand. So what you want to do is you want to start from the wrist and work your way up the arm. So what you want to do is you want to start wrapping, and you want to make sure you wrap around twice to anchor the bandage into place. And then basically what you're doing is you're just wrapping the bandage all the way up the arm. And again, it's important to make sure that you don't wrap the bandage around too tight. So you want to check the circulation in the hand and fingers when you're finished. And then you just put it in place. For the final part of this video, I will discuss briefly about pin care. You want to treat your pin sites as surgical wounds. Keeping them clean is important to prevent infection. Cleaning also promotes comfort and prevents healing skin from adhering to the pin. The first step you want to do is gather your supplies, and this includes the ordered solution that your doctor prescribes to you, any sterile cotton swabs, and sterile gauze. After you gather your supplies, you want to practice hand hygiene and put on gloves. Next, what you want to do is you want to massage the area around the pin to promote drainage and bring blood to the area. If any drainage is present, you want to clean it away. Next, what you want to do is you want to pour your ordered solution into a cup, and then take your sterile cotton swab and dip it into the solution, and you want to clean around the pin site. So what you want to do is you want to start from the closest part of the pin and work your way around, and then move farther away from the pin while still cleaning around the pin site. After you clean around the pin site, you want to discard the dirty cotton swab and grab another, and then repeat the same steps. After the pin site is clean, you want to take another sterile cotton swab and dry the area. So what you're going to do is you're going to take the cotton swab and do the same technique except with a dry cotton swab. So remember, you want to start closest to the pin site and work your way away from it. Next, after the pin site is cleaned, you want to clean the pin itself. So you want to use another either sterile cotton swab or a sterile gauze. So basically, you would just clean the actual pin site. And after your cotton swab is soiled, you just want to grab a new one and clean around it. Finally, you want to let the pin site air dry. It's important to teach children and their parents any signs and symptoms of infection. These can include foul-smelling drainage from the pin site, any redness, warmth around the pin site, and also if it's painful to touch.